Ever wondered what causes that painful sore throat? It could be strep throat, an infection caused by a specific type of bacteria known as Streptococcus pyogenes. This pesky bacterium is highly contagious and primarily targets the throat and tonsils, causing discomfort and pain. It's a common ailment, but one that shouldn't be taken lightly due to its contagious nature. So the next time you have a sore throat, it could be more than just a common cold. It could be strep throat. How can you tell if you have strep throat? What are the symptoms? Well, first off, one might experience a severe and sudden sore throat. This isn't your typical tickle in the throat, but rather a strong, painful sensation. Accompanying this, one might feel pain when swallowing, making even the simplest sip of water a task. A fever over 101 degrees Fahrenheit often accompanies strep throat, making you feel hotter than usual. Swollen tonsils and lymph nodes are also common, creating a feeling of fullness in your neck or throat. A peek in the mirror might reveal red and white patches in the throat, a telltale sign of inflammation. Less common symptoms include headaches, a rash, stomach pain, and nausea. These might not be the first signs you think of, but they can certainly accompany a case of strep throat. Remember, not all sore throats are strep throat. These symptoms can help you identify if it might be strep. Now you may be wondering, how do you get strep throat? Well, the culprit behind strep throat is a microscopic villain known as Streptococcus pyogenes bacteria, a rather unwelcome invader that causes inflammation and pain in your throat. This bacteria is quite the social butterfly. It loves to travel through the air in tiny droplets, hitching a ride whenever someone with the infection coughs or sneezes. It's like an unwanted guest that crashes the party, spreading quickly among those who are close by. But the bacteria doesn't just travel through the air. It's also quite good at settling down on surfaces, lying in wait for the next unsuspecting person to touch that surface, and then their face. That's another way it finds a new home and causes strep throat. Remember, this bacteria is a master of evasion, but there's one thing it can't stand: good hygiene. So washing your hands frequently and avoiding close contact with those who are infected can help keep it at bay. The best way to avoid getting strep throat is by practicing good hygiene. Strep throat may sound scary, but don't worry, it can be treated. Typically, doctors prescribe antibiotics to kill the bacteria causing the infection. It's crucial to take all of the prescribed medication, even if you start to feel better before it's done. This helps prevent the infection from returning or causing complications. But treatment doesn't stop with antibiotics. Home remedies play a significant role as well. Rest is the first step. Your body needs energy to fight off the infection. Hydration is also vital. Drink plenty of fluids, especially warm ones like herbal tea or soup, which can soothe the throat. Over-the-counter pain relievers can help with discomfort and reduce any fever you might have. Don't forget about throat lozenges. They can offer temporary relief by numbing the throat area. But remember, these are not a substitute for proper medical treatment. With the right treatment, you'll be back to feeling well in no time. In summary, what have we learned about strep throat? It's a bacterial infection caused by group A Streptococcus. Symptoms include a sore throat, fever, and red swollen tonsils. Treatment involves antibiotics to kill the bacteria and relieve symptoms. It's crucial to maintain good hygiene to prevent the bacteria from spreading and to complete the full course of prescribed medication if diagnosed. Remember, when in doubt, always seek medical advice. Stay healthy, everyone.